The candidate is asked to provide perineal care to a resident who's incontinent of urine. The resident is lying in bed on a wet underpad and is wearing a hospital-style gown that is dry. After she completes her beginning steps, she will raise the bed, she will apply a first set of gloves, she will apply the bath blanket, and remove the sheet to the bottom of the bed. Next, she will remove the soiled underpad and replace it with a dry one before she begins the cleaning. She'll pull the resident towards her in 3 sections, rolling away. Rolling up the cloth pad, the wet one. And placing the clean one. She will come around to the other side. Pull the resident towards her. Roll away. Rolling up the dirty wet pad and placing it in the hamper. Pulling the clean one out. Next, she will ask the resident to check the temperature of the water. She will raise the legs. She'll place a barrier towel over that clean underpad to keep it dry. And begin washing the perineum. The first washcloth for soap. She will start on the far side of the groin from top to bottom, one swipe down the groin, different spot of the washcloth across the top of the perineum. To the close side groin, one swipe top to bottom, different spot of the washcloth, and remove that to the bottom of the bed where she has a cloth pad to keep the wet washcloths. Now she'll rinse that same area. Far side groin, top to bottom. Different spot across the perineum. And down the groin, close side, and remove that washcloth to the bottom. Next, she'll have a soapy washcloth for the labia area. Always wiping front to back and top to bottom. She'll begin with the far side labia from the top to the bottom on the outside. A different spot of the washcloth on the close side. And down the center. Removing that washcloth to the bottom. She'll rinse that same area. Far side, close side, and down the middle. Removing it to the bottom, and then she'll use her drying towel and dry the entire area. The groins, the perineum, and the labia area. She'll remove the barrier out. Put the legs down. Cover the resident back up. And then she'll change her gloves before going to the rectal area. It's noted for practice purposes to put the legs up without being covered, but for testing purposes, it's helpful to keep the bath blanket at least over the knees. Next, she'll pull the resident towards her and roll away. And now she's going to begin the cleansing of the rectal area. Using the barrier towel along the back and keeping the cloth pad dry. She'll use the last two washcloths to wash the rectal area. So she'll clean the top buttock from the rectal area up. The bottom buttock, different spot from the vaginal area upwards towards the neck, and the crease, putting that washcloth on the bottom. She's going to rinse that same area. And using the drying towel, dry that same area. She'll pull the bath blanket out. Putting it to the hamper. Remove her gloves to lower the bed. Now she will put her gloves back on, take the basin to the commode, dumping it in the commode. She'll rinse it out, small amount of water, dump that in the commode, set it on the barrier, dry it out with a paper towel. Disinfect if disinfectant is being used. Removing her gloves. Return the basin to the nightstand.